We'll start off today with that decision which broke yesterday in the health sector. We're joined now to discuss that. Dr. Oseni Saliu is the Vice Chairman of the Medical Guild. Thank you for coming on this morning.
Thank you very much.
Well, yesterday that circular for presidential directive suspending a residency program in the country, and then the termination of training appointments to the affected resident doctors in federal hospitals. Was it a surprise to you?
It's not really a surprise because this is an issue that has been dragging. To start with, it's a case of punishing the child for the father's sin.
How?
Because this present strike was actually called by enemy. Enemy is our parent body, and we are bound, even by law, to follow the instructions from enemy. Terminating or suspending residency is tantamount to saying that we don't have teaching hospitals in Lagos, in Nigeria anymore. Over the years, if you look at it, people have been enjoying better medical services because of this, the availability of more specialists. Our leaders have access to foreign attention. We know people that die overseas, going for medical tourism and all those stuff. The poor masses don't have that benefit. If the government is really going to be sincere about terminating residency, I think the first thing is to put a ban on public officers from leaving the country for medical services. Because you are depriving the public of their benefit of getting the best of medical services. For instance, the Lagos State hospitals has less than 20 general surgeons, manning as much as 27 general hospitals and a teaching hospital. But with the advent of the residency and participation of medical doctors, this has improved. Same thing with the springing up of the MCCs. People are now having better services from specialist gynecologists. You understand? So trying to stop residency, first of all, means that there's no teaching hospital to start with. Secondly, you will have limited number of doctors becoming specialists.
Is it that there will be no teaching hospital, no more, or that you will not take on resident doctors?
That's the meaning. What to make a teaching hospital is resident doctors. Resident doctors are doctors that have gone through medical training, have done their house job, have done their NYSC, and now have decided to specialize in a particular field of medicine.
So what they've done is that they have suspended, because I think that that word is online. They said they've suspended it indefinitely for the purposes of appraising the challenges facing the health sector.
Well, it depends on what challenges they are trying to analyze. The primary fight of enemy is about for the benefit of the public. Look, let's be realistic here. We are being sentimental. A pharmacist, a laboratory scientist, a nurse that went through training. Nurse is career path. You understand? To now become qualified in this field and look for a short way to have equal opportunity as people that have really been trained for those services does not make sense. But if perchance, if while you are on here, you have an experienced air hostess who's probably been with the service for like 20 years, who has backing, both legally and influence-wise, and suddenly say, I want to take over from the captain. Will everybody just fold their hands and say, okay, let the captain move, let the air hostess move us on the flight? We're talking about life here. We're trying to prevent quackery. That is what enemy is doing.
But you know, what do you say to those who say that, well, the enemy left the government with no choice. They pushed them to the wall. And as such, they had to
I think the reality here is government need to live up to their responsibility. They should not blackmail doctors with Ebola, for instance. Yes, Ebola is a very devastating disease. But the truth of the matter is that all doctors don't have to call off the strike to attend to Ebola. In fact, the lesser the number of people that get contact with patients, you've been mentioning people that contacted this thing, doctors and nurses.
No, but
What we are saying here,
but we also know that it is not that when you go to treat them, you expose yourself. If you go to treat them and you don't expose yourself, are you at risk?
Well, you're not at risk. That is exactly the question the Lagos State chairman of NMA was asking. Show us one PPE. We've been watching it overseas. People have been showing doctors and health providers rendering services to these people in their PPE. We've not been able to see any PPE. I'm a union person. The chairman of Lagos State is a union person. This thing is happening here. The reality is that we are going to be sincere with ourselves. What stops the Minister for Health from leading the team in the emergency Ebola team? Why can't the minister actually make an announcement from inside that place?
Does he have to?
He doesn't have to, yes. But you see, that will go a long way to reassure people that, yes, these things are there. I can tell you categorically that even some of us that are close to the chairman of NMA emergency response to Ebola is working hand in hand with the international team. But the truth of the matter is that as we stand today, we don't have evidence that even our members that are in the service there are well protected. That's what I'm saying.
That's on the one hand, but the members of the public don't understand. They don't know that. Because what if the NMA has said, okay, we've listened to the cry of the public. This is an emergency because the government has declared emergency in the health sector following the outbreak of this virus. And then the NMA says, all right, in the meantime, we will call up, we will suspend the strike. And then you get to the place, if you don't see any PPE, you let the people know, well, sorry, we've come here, we've not seen any PPE.
That's what I'm trying to let you know. Calling off the strike is not the solution to Ebola. We have about 20 Ebola victims presently, or it's 11, less 11 for 20. The truth of the matter, you don't need more than 5 doctors to take care of 20 Ebola victims. That is what public health is about. The main key control is the public awareness, which is what is going on. But you see, government is just trying to blackmail enemy into reloading them into calling off the strike.
Well, you talked about...
Instead of addressing the issues that are on ground.
You talked about service, providing... you said since Residency came on board, there has been wonderful service in the health sector. You know, things have gone well. Nigerians have felt better medical services. Yeah. But you also know, and the last how many years or so, when we have been experiencing this frequent strikes, as it were. I mean, doctors going on strike is no longer news. Is no longer such big news. Where and how did we ever get to this stage where, you know, it's no longer news that doctors are going on strike?
Well, if you really follow the trend of events, you realize that what we've been going on strike for had always been the same thing. But this particular one has to do with the integrity of the profession, survival of the public. You ever have a situation where you walk into a lab, a test is done, the next thing the lab scientist or technologist is already prescribing drug. By the time the patient is presented at the doctor's place, the drug is not effective. You have a situation where a pharmacist go and see a patient and the next thing is prescribing. All they're trying to do is to legalize this. You know, and that will further worsen the condition of the public.
How can the government know? Just a moment, sir. You know, how can the government know that this is what they're about to do? I mean, as you rightly said, it stands logic on its head when you say that, you know, someone who is a hostess wants to take over the job of the captain, and the government is opening its eyes and saying, yeah, that is the perfect situation here. It doesn't make sense, does it?
You see, that's what I'm telling you. If you follow this,
it cannot be that the nurses and pharmacists want to be doctors. It cannot be, can it?
That's what is happening. You see, the reality here is, if you follow this thing, what the public sees is the strike. What goes behind the strike is really intense work. There's a lot of deliberation, a lot of negotiation. I mean, I was part of the last team that recalled the Lagos State Staff Doctors. And I'm very much believing that Mr. President is being misled by his agents. That is very, sorry please, let me just land. Because this is the same person that was against this type of action. He actually resolved that crisis. then. I was part of that negotiation team. You understand? So I want to believe that it was probably misled. Putting the term suspension of residency is equal to sacking 16,000 doctors. That's the meaning. Tell me, what are you now going to do? Recruit some non-specialized 16,000 doctors from where?